I need to see a psychiatrist now.
Don't listen to my husband, Ben. You're being ridiculous.
Sir, you need to wait for triage.
It's okay, Leah. Hi, I'm Dr. Charles. How can I help you?
Listen, I need to check myself into the psych ward.
No, he doesn't. He's not crazy. Ben, please. People are listening.
Do you think I care? I need to be committed for as long as it takes to stop these thoughts.
Okay, I understand. How about if we step into this room over here so we can discuss your
No,
situation?
no more talking. I don't need to talk. I need to be locked up.
Ben.
You send me back out of there, then I'm going to murder my wife. Shortly after my wife got pregnant, I started having these thoughts.
Okay, take your time.
It's all right. No one here is judging you.
I'd imagine killing her, slashing her throat with a knife, to be specific. I can't even be around knives anymore, afraid of what I might do.
It must be terrifying. Can I ask you, was this pregnancy planned?
Yes, no. We both wanted it. I don't have an escape fantasy. I'm not jealous of my unborn child.
It sounds like you've been seeing some other therapists.
Two. One wouldn't even be alone in a room with me. Thoughts only got worse after that.
I'm really sorry you had to go through that. You know, sometimes when we overfocus on fixing problems like this, not thinking certain thoughts, it tends just to tighten their grip.
Like if I tell you not to think of a brown bear, you'd immediately picture it.
Look, I'm telling you, I'm a real danger. I need to be committed.
It seems to me that Ben is suffering from some sort of OCD. Other than that, he has no functional impairments.
We're not talking about overwashing your hands here or checking the front door every 2 minutes. This is OCD harm. His thoughts toward his wife are violent.
Judging from Ben's history, there's no reason to think he would act on it.
We don't know that. I mean, what if we send him out here today and he does? I really think that committing him is our best option. Put him in an environment where he feels safe from his thoughts, help him diffuse them, or at the very least, coexist with them.
What if the right move isn't to make him feel safe from his thoughts? What if it's to make him confront them directly?
You mean exposure therapy? Dr. Reese, I know that's been very helpful to you, but in this case, that approach would be extremely risky and way too early. We need time to fully evaluate the patient. Okay, so let's commit him to the psych ward and take it from there. Okay?
Have a seat, Ben.
Wait, have I been committed already? Shouldn't I be medicated or in a straitjacket or something?
So the nurse is preparing your admittance paperwork, but in the meantime, I would like to talk to you about something.
Talk about what? I already told you. I've done every type of therapy in the book. The thoughts won't go away.
I understand. But what if I told you that most of the thoughts we have are just nonsense? Just synapses popping off in our heads, and that we shouldn't take them so seriously? If you could, just do me a favor for a moment. Close your eyes. Now, I want you to bring up the thought that frightens you the most. Tell me what you see. It's okay. You are in a safe space.
I see myself. I'm holding a knife.
Keep going.
I see my wife. She's in the kitchen doing dishes. I'm walking up behind her. She doesn't know I'm there.
You're doing very well.
What's that?
Page Dr. Charles, let me know when he comes
Kayla.
out here. Here he is.
I got your page. What's up?
It's Dr. Reese. She's left in with a patient.
You've conquered your fear of holding a knife. A weapon. Now imagine that I'm your wife.
can't.
You can. I trust you.
Do you see her?
Yes.
Here's your opportunity. You can slit my throat right now.
No. But I don't want to. I don't want to do it.
No, you don't.
This whole time you've been beating yourself up over your thoughts.
The fact that you can't dismiss them does not mean you're depraved. It shows you have a conscience.
Dr. Reese, outside, now.
Dr. Charles, I know I didn't take your approach today.
Didn't take my approach? You directly defied my orders and put yourself and your patient in real danger.
Ben isn't dangerous. I think I just proved that.
The only thing you proved to me is that you're reckless and insubordinate, and I have half a mind to suspend you again.
The last few months, you've been preaching to me that I can either see my patients as a threat or as an opportunity. Was I afraid in there? Yes. But my fear no longer controls me. I control it, and now Ben controls his too.
You are missing the point. I appreciate that exposure therapy has given you a newfound sense of confidence, but it does not make you all-knowing and invincible. What you just did in there was unbelievably stupid.